coming together over the pons, and then here are the carotid arteries coming in. Okay. So this is on the inferior surface of the brain. This is not difficult except in trying to visualize it. So we have a couple of vessel brains that have the vessels on them. So in that view, you're kind of like looking like this, okay, up underneath. So the carotid arteries are going to be coming up the neck like this, and the vertebral arteries are going to be coming up through the foramen magnum like that. So we're looking at an inferior surface. So may I erase the terms on here?
Wait.
Yeah, anybody need pictures?
I was just going to ask, on number 13, the superficial temple. So both of those, the split,
Yeah,
both
this is
considered?
the multiple branches go out. They're all considered to be superficial temple. Okay? You set? Okay. I'm going to leave the diagram up and just erase the terms so I can.
That's what I forgot to write. That's not what I know.
So passing up through the foramen magnum, we have the two vertebral arteries. Remember, this is on the ventral or inferior surface of the brain. And they join together inside the brain. So over the medulla, they're forming two separate vertebral arteries. So the vertebral arteries are going to, their branches, like we talked about last semester, pica, are going to supply the medulla. So blockage of those vertebral arteries are going to result in a decrease of blood supply to our cardiac, cardiovascular, and respiratory centers, and so that can cause death if those centers aren't working. And then over the pons, the two vessels join together to form a single vessel. Remember the pregnant belly, beer belly of the pons is known as the basal pons. And so this is identified as the basilar artery. And it's going to supply blood to the pons and cerebellum. Probably the midbrain as well. Right at the midbrain level, the basilar artery ends by branching into two vessels known as the posterior cerebral arteries. And that would be these right here. We have three cerebrals, posterior, middle, and anterior. The posterior cerebral arteries are going to supply blood to the cerebellum and the occipital lobe, where vision is processed. So that's what comes from the vertebral arteries, those first two sets. Then we have the internal carotids, and this is kind of weird to draw because they're coming towards the screen, and then those vessels have been cut. Okay, so again, you have to recognize you're looking up and underneath those vessels. IC stands for internal carotid. And the largest branch of the internal carotid passes out of via the lateral sulcus out to the surface of the brain. And most of the brain tissue is supplied by the middle cerebral arteries. So it's going to be supplying the frontal lobe, parietal lobe, temporal lobe, insula. This is the one that's most commonly affected by blood clots resulting in strokes. So if someone has difficulty walking, paralysis, a droopy face, difficulty in speech, that's going to be due to all these vessels that you see right here are branches of the middle cerebral artery. You're going to branch up to within about an inch or so of the longitudinal fissure. These branches back here are coming off of the posterior cerebral artery. Next set of vessels branching from the cerebral artery are much smaller. They're going to pass through the longitudinal fissure and over the corpus callosum. And they're going to supply this medial surface of the brain. So the medial surface of the frontal and parietal lobes. And that's these two vessels right here. Anterior cerebral artery, again supplying medial surface of the brain. Now, so far in the diagram, my internal carotid artery vessels and my vertebral artery vessels have not yet joined. So if I have plaque in my internal carotid artery, blood from my vertebral artery is not going to be able to flow out the middle cerebral artery and prevent any kind of functional loss. And so we have three communicating vessels that join these two sets. Between the posterior cerebral and middle cerebral, we have two posterior communicating arteries. And now we have those two systems connected. Posterior communicating?
Medial surface.
Oh, medial surface, S-U-R-F-A-C-E, I'm just abbreviating. Surface. And then connecting the two anterior cerebrals. We have a single anterior communicating. And again, those vessels are visible inside this model. It's the vertebral and the internal carotid arteries coming through the skull.
You said their purpose is to bypass the system?
Not to, yeah, so let's say that our vertebral arteries are, this one is blocked through an atherosclerotic plaque. That would mean that I would have very little blood flow going to my occipital lobe and my cerebellum. But now blood from the internal carotid arteries, because pressure here is low since there is less blood flow, blood from the internal carotid arteries can come through the posterior communicating and go out the posterior cerebral. If my internal carotid artery in my neck is blocked, so I don't have blood coming in here, blood from my vertebral artery can come up through here and go out the middle cerebral. So it allows an anastomosis or a connection between those.
Is that like an example what you did of tracing a drop of blood? Basically, if one was cut, you trace it.
Okay, so if I were to say trace a drop of blood from the heart to the occipital lobe.
Right, but no, you won't do that to us with an artery cut?
What do you mean? Oh, blocked?
Right.
No.
Okay, that's what I was asking.
So if I were to say, but that's a good question about tracing. So if I were to say trace a drop of blood from the heart to the occipital lobe, since it's occipital lobe, the first spot should be the vertebral system. All right? So what blood vessels would you do? I'm not going to go slow enough to write this down, but you can trace it through. ascending aorta. We're doing the right side. We would go out the brachiocephalic trunk to the common carotid. Up, I just did the wrong thing. We're going to vertebral artery. Sorry. Start again. Ascending aorta, brachiocephalic trunk to subclavian artery, to vertebral artery to basilar, to posterior cerebral, to occipital lobe. Okay? You're just following it through like you were a road, and you had a little play card that you were moving through and naming the vessels that you were going along. Okay?
The
All right. Yes?
subclavian starts at the branch.
The
With the fork?
subclavian, yeah, so a brachiocephalic trunk divides and forms two vessels, common carotid and subclavian. Alright. We're going to look at two more branches of the subclavian, and then we'll stop, and you guys can work on the models and stuff with just what we have here. Tomorrow we'll, in lecture, we'll go through the others. So the additional branches that we're talking about that come off the subclavian are the thyrocervical trunk. Anytime you see trunk, it means it usually has multiple branches. Here's thyrocervical trunk. It's going to give off branches to the neck, down to the back, over the scapula. Okay, so it's going to do this lower neck region as well as the back of the scapula. There's an artery that goes back to do the scapula. And then the last one I want to do is this little branch right here. We'll pick it up tomorrow when we talk about the blood supply to the chest. It's coming off of both subclavians. There's a vessel that runs down about 2 inches lateral to either side of the sternum. So it comes down on either side here, and from that we get our branches that are going to the front of the ribs. And this is known as the internal thoracic. I believe it's number 18
Yep.
on your list.
Okay, so yeah. So that's 15. So then after 15, there's
Right, so looking on the deep surface of the chest wall here, you can see these vessels coming down. That's internal thoracic. And tomorrow we'll follow its branches going out between the ribs, which are the intercostals, thank you, blood vessels. All right, so
On your drawing,
yeah.
which one is 16 going to?
I know, that's what I was gonna ask.
16 is this one right here, the inferior trunk.
And it just has those 3 branches?
Yeah, it just has multiple branches.
Okay.
Right. And then I have on there, I think 17 is inferior thyroid. You don't have to worry about that one, so you can just cross it off.
17?
So 17 is inferior thyroid.
16.
Not worry about that one. And then 18 is going to be internal thoracic artery. Okay, so we'll stop there. Now again, when you're practicing this, just draw a line. Okay, you don't need to go to the trouble of drawing the separate hollow channels there. Just take the heart, aorta, coronary artery, brachiocephalic trunk, common carotid subclavian, common carotid subclavian, and just kind of follow that through as you're visualizing it and following the blood supply to the organs. Okay, so the rest of the class time, we have the head models, we have the brain models, the skull models. In the back, we also have these vessels known as circulatory trees. These wire models, they're a bit scary with all these wires leaking out.